we will keep those logged so that way we can ask those at the end and keep those included. Questions come up as presentations happen. You may have not thought about something that our amazing speaker will say, who I will introduce shortly, may trigger something for you, and you just have to, get it out there. The chat feature is going to be the best way to do that. Also, during the presentation and out of the courtesy of our speaker and his time, please keep your mic muted through the presentation so everybody can hear him, have a joyous experience. And then during the Q&A, you can choose to unmute and ask your questions, or you can just use the chat feature and we'll be able to do that for you at the end. At the closeout, we would really, really appreciate it if you would complete our 3-minute post-webinar survey. This actually helps us ensure the impact of our webinars and can also guide the content of the follow-up conversation that we have with this 2-part series for next week. And then finally, this program is made possible by our donors, with a special thanks to Global Genes. Many applause. You can use the applause option in there if you'd like. The FDMAS Alliance is a recipient of the Financial Advocacy and the Rare Impact Grant, sponsored by Global Genes. And thanks to this award, the Disability Benefits 101 is made possible. And then as part of the patient advisory and a member of the FDMAS community, I am very excited to be having this conversation with you guys. And I myself am very, very excited to learn just as much as you have. I was able to have a kind of precursor into this, and I can just let you guys know you're going to get some great information. I will now be introducing our speaker. Michael Beloff is a wealth advisor at Belvedere Wealth Partners. Inspired by his son with autism, Michael has become a chartered special needs consultant with extensive training and continuing education on the complex topics, in particular challenges of caring for a dependent with special needs, including the constant changes in the federal and state laws. So, expert. Michael's expertise and ability to educate and empower has made him a noted speaker on the topic of special needs and disability planning at both the national and local venues. Michael serves on a number of volunteer boards, including Abilis, where he also serves as a treasurer, an agency serving intellectually and developmentally disabled individuals in Lower Fairfield County, Connecticut, the Connecticut Governor's Workforce Council DEI Committee, and the advisory board of the U.S. Autism Association. A graduate of SUNY Albany and Columbia Law School, Michael lives in Stamford with his wife, Deborah, and son, Ben. And with that said, I would love to pass the torch over to you, Mike.
Great. Thank you, Sarah. And Tova, you can unshare the screen. I can bring the slide that might be helpful for folks to follow along. There we go. Okay. All right, here we go. So, and thanks for the introduction. And just to kind of give you some additional background, my day job is as a financial advisor. So I spend a lot of my time working with clients to go through their long-term financial goals and help to figure out how we reach them through planning and managing investments. But a large part of my time is working with individuals, with disabilities, because the planning needs are very, very different when you might have to rely on benefits and services as part of a state and federal government benefits to help meet your long-term goals. And so this particular presentation was set up to give folks a background in how different government benefits work, how you qualify for them, what you get out of it, and so forth. In the part 2, which will be next week, once you have kind of the basics understanding of how and why people get benefit services, we'll talk a little bit more about for those who do work and then have to stop working or want to go back to work, understanding how working affects some of these government benefits and some of the things to look out for as you're trying to manage that and make sure that you can access your self-care and especially medical benefits, which I imagine for this population are very, very important given the health concerns. Because I work for a financial institution, I'm required to leave the screen up for about 3 seconds for all the disclosures. We're going to start with what government benefits are available and what they provide and how you qualify for them. And there are a variety of them. Some are means tested, which means they're based on having a financial need or being financially needy under what the government would call financially needy. Those are programs like Supplemental Security Income, Medicaid, SNAP, and Housing Choice Voucher programs. And there are some disability benefits that are not based on financial need, but based on other items such as Social Security disability income and Medicare. And these are the primary benefits that we're going to be talking about. Usually in these kinds of presentations, I try to have save questions on a particular topic to the end of a topic because we may get through some of the questions you have. And so at the end of each one, we can stop and take a couple of questions through the chat. And then for everyone who asked questions through the email to Tova before this, we'll address all those questions at the end. In looking at it, you can look at kind of a little chart here of there are both monetary benefits and there are medical benefits, and there are benefits that are means tested and non-means tested. And you can see one of the challenges is the names all sound alike. Everybody gets SSI and SSDI mixed up. Everyone gets Medicaid and Medicare mixed up. It is confusing. You are not the only one who mixes them up. It's taken me about 20 years to get to this point where I can talk about these things very succinctly and clearly. And it's quite possible that other folks that have tried to describe these benefits to you may have conflated them. And sometimes they interact and you can have more than one at the same time. But first, an important starting point is, what does it mean to be disabled? So the government on a federal level has a very distinct definition of what it means to be disabled, and it changes based on your age. So there's a definition of disability for individuals who are under the age of 18, and a definition of disability if you're over the age of 18. If you're over 18, you're only disabled, I sometimes call it federally disabled, if you have a disability, a physical or mental disability, which is going to be long lasting, i.e. last more than 12 months or result in death, that prevents you from engaging in something called substantial gainful activity, which means work. But the government's definition of work is different from yours and my definition of work. The government's definition of work, which they call substantial gainful activity, for 2022 is $1,350 a month. That means in order to qualify for government disability benefits, your disability must prevent you from earning more than $1,350 a month. That's before taxes. That number changes a little bit every year and goes up with inflation, but that's the number for 2022. If you are capable of earning more than $1,350 a month or are earning more than $1,350 a month, you may not qualify as federally disabled. If you're under 18, for those of you who are parents of children affected by MDMAS, the definition is slightly different because they don't expect people under 18 to work. And so you are disabled if your impairment results in marked and severe functional limitations. That's the government's definition of disability. Now, keep in mind, that is the definition the government uses. If you have a private disability policy, either a group policy through your employer or a private disability policy you pay for yourself, they may use a different definition of disability for access to those benefits. And that definition is located in the terms of that particular disability insurance policy. And you should review that so you understand what qualifies. Usually, if you are federally disabled, you can qualify for your private disability policy, but sometimes not the other way around. So let's move on. Any questions about what it means to be federally disabled? Okay, I don't see any chat, so we're gonna move on. For many of these slides, just so you know, there will be some references down here at the bottom as to where some of these definitions and things come from, if you want to look these up yourself. So let's talk about means tested benefits. And again, these are benefits that not only do you need to be disabled, but you may also need to be financially needy. But and some of these are only based on financial need and not based on being disabled. But sometimes there are enhancements also disabled. So why don't we start with supplemental security income, or SSI. So SSI is essentially welfare. It's a federally funded income supplement fund program funded from the general tax revenues, not Social Security taxes. So FICA, that line item FICA on your paycheck, which pays for Social Security, does not pay for SSI. So for those of you worried that, or we may have heard that the Social Security Trust Fund is going to run out, that does not affect SSI because SSI comes from the general revenues of the federal government. It gets confusing because Social Security Administration administers the SSI program, but the funding doesn't come from Social Security taxes. SSI is designed to help the aged, blind, and disabled. That is a term that you will hear often with regards to benefits. It's what the government uses. Who have little or no income and resources, and will talk about how income and resources you have to qualify. And death. In general, it's important. SSI is to provide resources for basic needs, food and shelter. SSI can be used for anything for the individual who's receiving it. It's primarily people from being hungry and homeless. And then lastly, if you are over 18, and I apologize, I think there's someone at a hand up, we'll get you in a second. When you're over 18, the asset and income thresholds, which we'll discuss in a second, are only based on that individual's assets and income. But for a child under 18, the parents' assets and income are deemed available to them, meaning that for a child to get SSI, not only do they have ability, but their parents need to meet the asset and income requirements, which can be very, very challenging. Let's talk about what you get. So at a maximum, SSI provides up to $841 a month in a monetary supplement to individuals who are eligible. That's the number for 2022, and that number goes up a little bit with inflation. Am I cutting out for everybody?
Yes.
Hold on a second. I'm going to try to go on a headset. That might help. I apologize if I'm cutting it out. Let's see if I can. If you give me one moment. Okay, so I apologize for the sound issues. I'm going to attempt to, give me 1 second here. I'm going to call in instead, and that might help with the sound issue. Give me 1 second to use that number. And I apologize for the sound, but hopefully this will help in a second. Uh, I've just, hold on, I gotta mute my face.
There we go. Can everyone hear me now? Like we're still getting a reverb, so hold on one second. Okay. Can you all hear me now without a reverb? Okay. So just so you know, my microphone's muted on my end, so I won't be able to hear questions when we go to Q&A. I will turn that off, and hopefully this will work out better. So I apologize for that. So as I started to say, the maximum SSI benefit is $841 a month. That can be reduced in certain circumstances that we'll go through. There is also an income test and an asset test. The income test is fairly simple. For single individuals, you can't have countable resources greater than $2,000. We'll discuss in a second what is and what isn't a countable resource. For married couples, you get to have a little bit more money. You get to have $3,000 in countable resources. In addition, there is a maximum income that'll make a little bit more sense when we get to the next couple of slides, so you see what happens with your SSI if there's income. And so we'll go on to the next slide. What is a resource? So a resource for SSI purposes are things that you own like cash, bank accounts, stocks, savings bonds, life insurance, personal property, cars, basically anything else that you could own that can be exchanged for food and shelter, subject to certain exclusions. So if you have a bank account more than $2,000, if you're a single individual, you have too much money to receive SSI. Now that is an end of the month number. So they understand that if you're getting your if you have $1,900 in resources at the end of the month, and you get your SSI payment of $841, you now have $2,741. That is okay as long as you spend that money by the end of the month, so that by the end of the month, your total assets are less than $2,000. There are a bunch of exclusions. So a house does not count as an asset for SSI purposes, nor does an automobile, a burial space, a life insurance policy that you own that has less than $1,500 in cash value. SNAP food stamps do not count as a resource, and a variety of other things, including scholarships and so forth. But the idea is the asset limit, because it's a needs-based welfare program, the asset system, the assets that you can have to access SSI are very low at $2,000. And if you are receiving SSI and Social Security determines that you did not report to them that you had assets over $2,000, for any month that you had more than $2,000, Social Security has the right to ask for their money back. I've seen this happen for individuals who qualified for SSI, and they found those old U.S. savings bonds, which used to be those little paper bonds that your great Aunt Sue gave you when you were born and you stuck into a drawer and forgot about for 20 years. Well, that can cause issues and cause you to have to repay SSI money that you received. That's the resource test. There is also an income test. So for SSI purposes, income includes earned income, that means money that you earn, and includes unearned income. And we'll go into in a second what earned and unearned income is. But for SSI purposes, it also includes cash that you might receive that's a gift from somebody else, or anything you receive that can be turned into cash, like a gift card. All of those count as income for SSI purposes. There are some exclusions. They exclude the first $20 a month gross of regular income, and then the next $65 of earned income. That means you could earn, if you work, $85 in a month, woohoo, and not lose any of your SSI. These numbers, by the way, were set in 1974 and have not been adjusted for inflation since then. If they had been adjusted for inflation, those numbers would be about $200 or $300. In addition, some in-kind support and maintenance above the cap is excluded. I'll describe what in-kind support and maintenance is in a moment. Medical services, food and shelter received during a medical confinement, income tax returns, all of those don't count as income to you in the month received. But note that if you get money that might count as income during the month, if you still have it at the end of the month, it counts as a resource and counts against you as well for this needs-based benefit. By the way, if you see this down here at the bottom where it says POMS, there are actually rules to Social Security. And if you have problems going to sleep one night, you can look up the POMS, which stands for the Program Operation Manual System, and read about how Social Security works. I promise it will put you to sleep. So let's talk a little about what happens when you have income and what it does to SSI. Well, if you have unearned income, which again is interest on your savings account or just someone giving you money, that will reduce, after the first $20, will reduce your SSI dollar for dollar. And the theory behind that is the government is giving this as a financial subsidy to help people pay for food and shelter. If someone is giving you money, then you don't need as much government help that month, and they will take it away. In general, there is a 2-month delay from when income happens and it affects Social Security, SSI. So what happens is, if we're in August, if you have earned or unearned income in August, you are required to report that earned or unearned income to Social Security by the 5th of the following month. That means the 5th of September. Social Security will then figure out if that earned or unearned income will result in a reduction in the SSI credited for August. And that reduction will be reflected in your September payment. So SSI is always about 2 months behind. For earned income, the exclusion is a little different. You only lose $1 for every $2 of earned income above the essentially $85 cap. In addition, there can be some things called impairment-related work expenses, which we'll talk about much more next week. But essentially, if SSI is reduced to 0 in a given month, Medicaid benefits and health insurance may be at risk. And we'll talk about that a little bit more when we get to Medicaid. I want to talk briefly about what in-kind support and maintenance means. So I mentioned that SSI is primarily meant to provide food and shelter. Well, if you're receiving SSI and you're living with a relative or a parent or something like that, and they're giving you free room and board, or they're giving you under market value of reduced room room and board, that will reduce your SSI because that free or reduced cost room and board is considered unearned income for SSI purposes, and will reduce the SSI dollar for dollar. The government does have a heart, and they cap the reduction of SSI at 1/3. And so when I work with families who have children with disabilities when they turn 18, most families do not receive immediately the $841 in SSI. They only get about $530, or about 1/3 less, until you can prove that you're paying appropriate rent. The options are to either pay market rent, whatever that might be in your community, or have the child pay for their pro rata share of expenses of these particular 9 expenses: food, the mortgage, property taxes or rent, heating, fuel, gas, electricity, water, sewer, and garbage removal. Those are the 9 items that you have to pay your proportional share of. So if there's 4 people in the house and there's 1 child receiving or adult receiving SSI, that person would have to pay 1/4 of those 9 costs to not get the reduction in SSI. You may want to work with an advisor to help go through this if this is affecting you from this standpoint. So that is information about SSI, supplemental security income. Do folks have any questions? Any questions? Okay, so we're going to move on from SSI and go to Medicaid. So Medicaid is a jointly funded federal and state health insurance program for low-income and financially needy people. Generally, it's geared towards specifically children, the aged, blind, and disabled, and other people eligible to receive federally assisted income maintenance payments like SSI. If you receive at least $1 of SSI, generally you are eligible for Medicaid. As a joint federal-state partnership, typically half the funds come from the federal government, half the funds come from the state. There are certain things states will have to do for Medicaid, and certain things states get a choice for. That's why Medicaid is very, very different from state to state. Traditionally, Medicaid, besides being a health insurance program, provided institutional care for the aged, blind, and disabled. Think nursing homes and institutions for the intellectually and developmentally disabled. In general, Medicaid for the aged, blind, and disabled is the key to unlocking state services for adults. And again, whether there are services for your disability in your state is very much a state-by-state decision. And so it may be very different if you're where I live in Connecticut versus New York or Florida or Ohio or Nevada. Now, to be eligible depends on the state that you live in. In 34 states, if you're receiving at least $1 of SSI, you are eligible for Medicaid. However, there are another bunch of states called the 209B states, of which Connecticut is one, where eligibility for traditional Medicaid is based on different criteria. So for instance, here in Connecticut, like only 2 other states, they feel that $2,000 is too much money. And so therefore, they've set a lower limit, and you can only access Medicaid if your assets are under $1,600. Personally, I have no idea what they think that extra $400 will get you, but that is the rule in this state. In addition, though, it does allow our state to be a little bit more flexible in terms of some of our Medicaid-based benefits. Then there is an additional several states that are what they call SSI criteria states, where you use the SSI criteria for being eligible for Medicaid, but they can set certain other of their own rules, and that's Alaska, Idaho, and so on. In general, if SSI does go to zero because of earned or unearned income, including Social Security disability income, which we'll discuss in a moment, there are additional ways to qualify for Medicaid. U.S. citizens are eligible for Medicaid. In certain circumstances, non-U.S. citizens who are residing in the U.S., so folks with green cards, can access both Medicaid and SSI, but they have different criteria. In general, for a green card person to access SSI or Medicaid, they would need to be both A, living in the U.S. for at least 5 years, and B, had worked and earned 40 quarters of work services under the Social Security rules. We'll go through how the Social Security rules work in a little bit. As health insurance, Medicaid is what I would call broad but not deep. It covers a lot of things. However, as a health insurance program, the reimbursements that Medicaid gives doctors is very, very low. As a representative example, if you had a private health insurance policy that would pay a doctor $100 for a visit, if they took Medicare, a different health insurance program for seniors, which some of you may eventually be eligible for, maybe the reimbursement was $75. For Medicaid, the reimbursement to the doctor may only be $10, which is why many private doctors do not take Medicaid as health insurance, which can be challenging, especially for a medical condition like FDMAS. However, most hospitals are required to accept Medicaid as health insurance, although they're always challenged with doctors who are not necessarily hospital employees. That said, as medical insurance, Medicaid covers a lot. It covers inpatient and outpatient services, physicians, nurses. It covers dentists. Again, they have to accept Medicaid. It can be difficult to find them. Laboratory and x-rays, long-term and custodial care, prescription medications, durable medical equipment, and emergency ambulance transportation to a hospital. But in addition to the medical benefits of Medicaid, Medicaid can also allow access to services in a state through something called a waiver program. So a waiver program, essentially, you can think of it as allowing Medicaid to waive certain requirements, such as income levels, or the requirement that traditional Medicaid have that you have to live in an institution in order to access Medicaid services. Some of the more common waivers are the Home and Community-Based Services Waiver, which is generally how individuals with intellectual and developmental disabilities get services as adults. The Katie Beckett Waiver, which is a Medicaid waiver for children under the age of 18, where the medical concerns of the parents so outstrip the parents, the medical concerns of the children so outstrip the parents' ability to pay, the state is willing to provide additional supports through Medicaid for those hospitalization services. However, these waiver programs are not entitlements, meaning that you can't get them because you qualify for them. You have to qualify for under the terms of the waiver program, and the state has to fund those waivers. And many states, while they have access to these Medicaid programs, do not fund them adequately. That is why in many states there are wait lists for access to many Medicaid waiver programs. You should check if these programs might be applicable to you. You should check with your state social service agency to see what waiver programs may be available. Are there questions about Medicaid? Okay, then I'm going to move on and hold on a second. And we're going to go on to SNAP. So SNAP is food stamps. It used to be called food stamps. Everyone hated that term. And so now they call it SNAP. It is a federally funded nutrition program administered by the state. And so there are general federal rules, but states can modify them slightly. It's actually supervised by the U.S. Department of Agriculture. And again, those state and local agencies determine the eligibility, the amount of the stipend, and distribute the benefits. In general, you get an electronic EBT card, which essentially is a little credit card without the smart chip in it. The maximum SNAP benefit for an individual is $250. And for a couple, it is $495 at a maximum. And then it increases as the family size increases. In general, for individuals, unlike SSI and Medicaid, which are based on an individual's assets and not their parents' assets when they turn 18, for SNAP only, parent asset and income counts till age 22. Why is that? Well, if they let individuals who are financially needy get SNAP at 18, every college student in America would have to be on food stamps. And so under this federal program, you have to wait until 22 to get access based on your own assets and income. The monies be used for food items, basically groceries, but it can't be used for alcohol. Food is eaten in the store, hot food in the store, and non-food items such as pet food, vitamins, medicines, tinfoil, things like that. If you use your SNAP card, you don't get a big buzz, but if you have non-eligible items, it just won't pay for them, and you'll need to use another payment option to pay for those items. Essentially, SNAP probably has one of the lowest income requirements. For folks who are disability qualified through Social Security, there are certain exceptions, and there's exceptions for rent above a certain amount and certain higher income levels allowed than for folks who are not disability qualified. And as your income increases, the SNAP benefit might decrease down to zero. But in a pinch, if you're completely out of work, SNAP benefits can be a lifesaver for many people. And one interesting thing, unlike Medicaid and SSI, SNAP does not have an asset requirement. The only requirement is income. Any questions about SNAP? I hope I'm not boring everybody. And I just really hope that everyone can hear me. But I'm going to keep going. Let's talk now about affordable housing and Section 8 housing programs. There are, thanks, Nova. There are a variety of low-income housing programs. One of the best, if you can get it, although it is hard to get, is something called a Section 8 housing voucher. And essentially it helps provide low-income housing to persons with disabilities and low income. Essentially, sometimes it's tenant-based and sometimes it's project-based. On a project-based, there may be apartments that are set for low-income people who make under, say, $20,000 or $30,000, and these would be individual apartments in a complex that are earmarked for individuals with low income and have reduced rents. So if the average rental of a one-bedroom apartment is $1,800 in your area, as it is where I live in Stamford, an affordable housing apartment might be at a capped rent of $1,000 and only available to individuals of low income. But that apartment would be stuck to that building, and if you're in that apartment you want to move, you can't take that lowered rent with you. On the other hand, there are also Section 8 housing vouchers, which are often issued by lottery to low-income people, where you can then rent an apartment up to the median cost of an apartment in the area, and your individual rent for that apartment will be 1/3 of your income, approximately. And the federal government will then pay the rest. As an example, if you had a Section 8 housing voucher in Stamford, Connecticut, where the median one-bedroom apartment goes for $1,800, and your only income was SSI of $841 a month, then 1/3 of your income would be about $275. And if you found that apartment and a landlord who would accept the voucher, then your share of the rent would be $275, and the federal government would pay the remainder to the landlord. The nice thing about those vouchers is that those vouchers are generally portable, and you can take that voucher to the next apartment or the next town or the next state, if that's what you want to do, as long as you meet the income requirements for access to that voucher. Like I said, usually they're available through lottery. You can look up the lotteries in your state or area, although they are, I will say, very hard to get. That concludes the means-tested programs, the benefit programs for individuals who are financially needy. Are there any questions about these particular benefits for folks? Okay, so I'm going to move on to some benefits that may be more applicable, especially to the adults here, which are the non-means tested benefits, Social Security disability income, and Medicare. So Social Security disability income is very, very different from SSI. It's essentially getting your Social Security early. It is not based on financial need. You could have $1 million in the bank and still get SSDI. You need generally your own work credits. Ordinarily, and you may have heard this before, you generally need 40 quarters or 10 years of work in order to qualify for a Social Security benefit. However, if you're under 30, you may not need that much work. Generally, SSDI provides your Social Security early. It's a cash monthly benefit. And in some circumstances, it's not reduced by working. More importantly, once you get an SSDI benefit for 24 months, you get access to Medicare, a very different health insurance program than Medicaid. So how do you qualify for SSDI? Well, there's two ways. You can qualify under your own work record. Now, you get a quarter of work credited to you for a year when you earn $1,510 in a year. That's the 2022 number. That number goes up every year with inflation. The most credits you can earn in a year is 4. So if you have work and you earn $6,040 in 2022, you will get 4 work credits. If you make more than that, your credits are just worth more. You don't get more credits. And if you are younger, when you meet the definition of disability, remember, the government's definition of disability is someone whose disability prevents them from earning more than $1,350 a month. That's the government's definition. So if you're looking to access these disability benefits, then that's the criteria used. Carmel, I'll get to your answer in a moment, I promise you. Now, when you're not yet 24, you only need 6 credits or a year and a half to qualify for an SSDI benefit. And that the number of credits you need goes up by 2 every year until you reach 31, at which point you need 20 credits or 5 years of service, 5 years of working, in order to qualify for an SSDI benefit on your own work record. Now, the amount that you might get is based on the value of your credits. If you create a Social Security account at socialsecurity.gov, the Social Security's website, you can see how many work credits you have, and if you become disabled, what your SSDI benefit would be. Now, if you get an SSDI benefit and you're also on SSI, this may not be the case for all of the folks here, but SSDI does count as unearned income for SSI purposes. And so it will wipe out the SSI. You can't get both. You can't double dip. in general, for most people, their SSDI benefit will be greater than their SSI benefit. To answer one of the questions that came through is, if SSDI is getting your Social Security early, is it reduced, like if you decide to retire at 62? So if you're getting an SSDI benefit, you're done. You do not apply for Social Security early. And by the way, for anyone born after 1960, the full retirement age for Social Security is 67. That was changed in the 80s. Getting your SSDI is not considered taking your Social Security early. It's as if you did, but it's not considered taking your Social Security early. You do not get a reduction at full retirement age. However, because you have not been working, your SSDI payment may be less than if you had worked for your full 35 years to fully earn into Social Security. If you register for a My Social Security account, you will see on that statement how much you would get as of today if you qualify for SSDI. Okay. But there is a second way to qualify for Social Security disability if you never worked. This would be applicable for those of you who have children with FDMAS who are affected so much they'll never work, or if you were affected early and didn't build up enough work credit to qualify. So the concept behind this is called the Childhood Disability Benefits. And the idea is the government has assumed that if you become permanently disabled before the age of 22, that means that Social Security, by applying to Social Security for an SSI benefit, that your disability and that disability preventing you from working, that stage of the medical condition occurred before the age of 22. This is only for a more limited piece of the population. If that's the case, once the parent collects their Social Security payment due to death, disability, or hitting their retirement age, that triggers a Social Security disability income benefit called the Childhood Disability Benefit for the individual. They get 50% of what the parent's getting while the parent is living, and then 75% of what the parent gets when the parent passes away. Like SSDI on your own work record, you get Medicare for 24 months. And again, the SSDI is considered unearned income for SSI purposes. Now, for this particular benefit, you have to have been deemed not able to work before the age of 22. If you're able to work and earn more than $13.50 a month, that's the bar for working, then you may lose access to this benefit even if you were deemed disabled before the age of 22. It is complicated. And so if you were disability qualified before the age of 22 and then go look to work, there are some complications and things that you should consider in terms of how much you work before you collect this benefit. Essentially, if you're collecting the benefit under the parent's work record and you get married, they will tag you to your spouse's work record and not your parents, and you lose that. If you work too much, essentially, there is a whole slew of what happens when you work when you're receiving SSDI that I will cover at the next meeting because it's somewhat complicated. I wanted to make sure everyone had this base information. However, for SSDI purposes, there are things called impairment-related work expenses and some other items that can reduce your countable income. So if you need specialized equipment or services to help you work, and you pay for them, that are specifically related to your disability that allow you to work, then generally you may be able to deduct them from your countable income to keep you under that those limits where your SSDI might be affected. Before relying on this impairment-related work expenses, you may want to work with your Social Security contact and make sure they agree that that impairment-related work expenses is valid and valid enough to reduce your countable income. As this is a little chart describing the differences between SSI and SSDI. Again, SSI is means tested. SSDI is an entitlement based on paying into the Social Security system. There are asset limits to access SSI. There are no asset limits to get Social Security disability. The maximum benefit for SSI is 841. For SSDI, for the childhood disability benefit, it is based on the parent benefit or based on your work record. There are no reductions for unearned income for SSDI. Until you've exited the trial work period. I'm not going to go in today with the trial work period is. We're going to cover that next week. There are no reductions in your SSDI if you work. And in general, when you have SSI, you have access to Medicaid. When you have SSDI, you have access to Medicare. Someone said, it sounds like you can have SSDI for a period of time and then return to work and not receive it. Is that correct? Yes. So when you receive SSDI for any reason, they let you do something called trialing work, which means that you get in a rolling 5-year period, you can work any 9 individual months and make any amount of money from working and not lose your SSDI benefit. Once you go burn through those 9 months, you enter a new phase of Social Security called the extended period of eligibility, where working may or may not affect your benefit depending on how much you earn. And after that extended period of eligibility, Social Security may determine whether they still think you're disabled. And so they let, in addition, you may be able to keep your Medicare for at least 7 years if you start to try to go back to work again. There's a variety of rules, and I have slides to go into that, and we'll go into that in much more detail next week as we go through this. That covers SSDI. The last topic we're going to go into is Medicare. Medicare and Medicaid are very different programs. As a mnemonic, you may want to think Medicaid, aid is for poor people. Medicare, care is for old people. Typically, Medicare is a health insurance program for people 65 years and older who have paid into the Social Security system. However, it is accessible in general to some people under the age of 65. For this purpose is for people who have been receiving an SSDI benefit for 24 months. That's when Medicare kicks in. Medicare has 4 parts. Part A, which is the hospital insurance, which is free. Part B, which is the medical insurance that covers doctor's visits, which does have a premium to it. Part D, which is the prescription drug coverage. And then for some reason, Part C, which is different from A, B, and D, which is essentially a Medicare Advantage plan, which is a style of Medicare that's like an HMO, where there's very few copays, but you're stuck in a doctor network. Whether traditional Medicare or Medicare Part C are best for you will depend on your individual health needs and what the networks are like in your area. And you should research that for when you become eligible for Medicare. Medicare is not means tested. However, the premium for Medicare does have a financial component to it. The base premium for Medicare is $170 a month. As a single individual, if your earned and unearned income, basically your AGI is above about $89,000 or $160,000 if you're a couple, and don't quote me on those exact figures, your individual Medicare premium may be higher. You're eligible for Medicare, again, if you're 65 and older and have 40 quarters of paying into Social Security, receiving SSDI or the childhood disability benefits for 24 months, and certain diseases and states like end-stage kidney disease or ALS. You can be on both Medicare and Medicaid, and many people are. And if you're on Medicaid and Medicare, generally there is a program in most states for low income people for Medicaid to pay the Part B Medicare program premium of that $170. You have to proactively apply for it. So if you're on both Medicaid and Medicare or receiving Medicare and are considered low enough income, you should research that program. It's generally called Qualified Medicare Beneficiaries, or QMB, and see if you might qualify for that in your state. So that's today. I've been talking for about an hour. I'm going to go through now the questions that originally came through and see. So the first is, I'm on disability now, but it's reviewed every 3 years. Neurologist was a big deciding factor, but it seems next to impossible to get disability for FDMAS. How do I get info and help with reviews? So I think for those folks who are disability qualified, keep in mind that your condition with FDMAS is a little bit different than the typical disability person. Say the Long Island Railroad worker, which is the rail service where I live here in Connecticut. They imagine that the person was an able-bodied person, hurt their back, and they're trying to make sure the person isn't faking. Again, it's not that they don't trust you, it's that this is the rules for everybody. And so there are reviews every 3 years to make sure that you still meet the criteria, not that you still have your disability, but that the nature of your disability still prevents you from working. And so when they're doing that review, that's what they're looking for. They're not looking to see if you still have FDMAS. They're looking to see if the condition still prevents you from working. And that's the piece to keep in mind when you're going through one of these disability reviews. The next question was, if you can work full-time, how do you recommend preparing for the future in case your health declines? I understand disability insurance through one employer is a great method if the policy is portable, but I'm wondering more on the HSA investing side. Should we contribute more to retirement individual accounts while we can work and front load them? Are there programs geared to investing for the disabled or chronically ill? A couple of things there. If your disability started before the age of 26, so that's kind of a loaded question. It's unclear, but generally it means if you were deemed to be disabled by Social Security before the age of 26, there may be the ability to use something called an ABLE account, which is a relatively new disability savings account, but only for folks whose disabilities started before the age of 26. And so whether or not you qualify based on when and if you've applied for disability should be discussed with perhaps your financial advisor for your particular issues as to whether you qualify. An ABLE account essentially is a way to save tax deferred and then money is used for something called qualified disability expenses come out tax free. It is also not considered a resource for SSI and Medicaid and can help people qualify for those means tested programs. In addition, I would certainly recommend for those of you who are contemplating early retirement from the nature of the illness, certainly make sure you're funding your retirement accounts up to whatever your employer is going to match. But after that, you may want to consider using other vehicles. While there isn't, if you access your IRA prior to age 59.5, there is a 10% penalty tax for early withdrawals. Although if you're using it for medical expenses, there is an exemption for that 10% withdrawal, but that money can be expensive because when you pull the money out of the IRA, it's still, the entire amount still counts as taxable income. You may want to explore whether a Roth IRA, where you can access the money tax-free in many circumstances, the growth tax-free, or you may want to look into a regular investment account where accessing those funds may be easier than accessing it through an IRA. You also may want to engage the services of a financial advisor to help you with that long-term planning. I would say for those of you who do work, if there is access to a group long-term disability policy, either at a certain level or that you can pay into, I would strongly recommend looking at that, especially if that policy is what they call portable, meaning that if you choose to go to a different job, that you can take it over and pay for it yourself and keep it with you. You may not qualify based on having the diagnosis for a private disability policy, which is based on health status. But when you go into a company and they have access to a group policy, there is no medical underwriting. And that can be hugely important for your long-term planning. Next, what documents are needed if on Medicare, but currently working, would like to stop? I employed in the family business by my husband. So in order to access Medicare prior to age 65, you have to qualify for a Social Security disability income benefit. That means you have to have paid into FICA taxes and Social Security for the requisite amount of quarters for your age, apply, be accepted for the Social Security disability income program, and be on it for 24 months. At that point, you will qualify for Medicare. There is no other paperwork that's needed other than applying for your SSDI benefit. Is it true that for SSI disability, I would have a limit of $2,000 of assets between me and my spouse? So again, it's very, very important, and I see this a lot with written questions. Folks get confused between SSI, supplemental security income, and SSDI, Social Security disability income. Again, everyone does it because they're so similar. But for SSI, which is a needs-based benefit, for couples, the asset limit is $3,000. Again, it's meant for those who are extremely financially needy. However, if you've paid into the SSDI system, there is no financial neediness required for that. And so, depending on which benefit you're looking for, that will indicate whether you need to match the income, the assets and income. I have a longer one. I'm not going to read through the whole thing, but essentially, because there is SSI and SSDI differences, it's important to understand the differences between them, how you qualify them, and why that's there. I will say for those of you who are on a group disability plan and then take advantage of it, well, not advantage of it, then you use it because FDMS is progressed to the point where you can't work or you become disabled for a different reason. Group disability policies are an odd duck in that often they are what's called integrated with Social Security. That is one reason why group policies are much less expensive than private policies. What Social Security integration means is that they assume that after 6 months, you're going to apply for an SSDI benefit. And so let's say your group disability policy is $4,000 a month as a payment, and your Social Security would be $1,000 a month. What's going to happen after a certain period of time, the company will assume, even if you haven't, that you've applied to Social Security, and they will reduce your long-term disability payment by the amount that they think your Social Security disability income payment will provide. So they'll reduce that $4,000 payment by $1,000 if your SSDI payment is meant to be $1,000. I have met folks who have not applied for SSDI because they were afraid it would screw up their long-term disability benefit. That is not the case. In fact, they have expected you to do that, and they've lowered your payment because of that. It is important that you understand how your policy works. If the HR person in your company is not good at this stuff and can't explain it to you well, you should consider speaking with a financial advisor who can help you interpret the policy and understand how it works. Group disability policies, private policies like that, may have a different definition of disability than Social Security uses. And so it's important to understand how and when that policy might be triggered. What options are available and how to get started applying for them? If you're employed short time, so you can get medical insurance. Is there anything available to give you insurance so you can work less hours? Maybe. In many states, there are some companies are only required to give health insurance if you work a certain number of hours. So in Connecticut, companies can choose not to give health insurance if you work less than 30 hours a week. Each state has different health insurance rules, and you should try to get familiar with those in your state. Because of the Affordable Care Act, there are additional options to getting health insurance besides just working. They may not be as good or as rich as the workplace benefits, but at least you will never be fully uninsured. If you have a little bit of income or you're working self-employed or doing something, some kind of consulting work, there are policies through the exchanges. You know, one of the advantages of being at a company that offers health insurance is that they are subsidizing it, meaning that whatever you think, if you think what you're paying for health insurance is high, the company is paying more. For someone in their 50s who's paying $200 to their company for health insurance, the actual cost of that policy is probably $1,000 a month. And your company, as part of their employee benefits, are paying that extra $800. If you go out into the exchange, that policy is going to be the same cost. You may have to pay $1,000 a month for that policy. However, if you have some income, but not too much income, there may be credits to make that policy cheaper. If you're not, unfortunately, if you're not working at all and you're very low income, they do not subsidize the policies on the health exchanges. They push you into the Medicaid arena. How and if and what policies at what cost may be available to you is very much dependent on your income and should be looked at in your state and how all that works. The next one, how could a parent qualify if their child's care is affecting their ability to hold a full-time position? So this affects many families with children with disabilities where often only one, you know, assuming there's two parents in the household, only one of them is able to work full-time because they have a child with needs. That happened to us. You know, I have a 24-year-old son with autism and intellectual disability. He did not speak till he was 7 years old and needed extensive help and advocacy on behalf of us as parents. You know, my wife was the one who stayed home. And that, unfortunately, that often happens. There are, other than some of the Medicaid waiver programs like Katie Beckett waiver that help with the medical costs, there are not a lot of monetary programs unless the family meets the SSI criteria. There are, besides the asset limit, the income limit for SSI is a little bit higher for families. And so you can look into that. I think I'm getting the bell here to go. So I had a couple more questions here, but one question that came through, how can they determine that I can't work or can't earn more than X dollars a month? So we talked about how in order to be disabled under the law, you have to be earning less than $13.50 a month. Well, if you are earning more than $13.50 a month, by default, you are not disabled. You can only qualify as disabled if you're not able to earn that, and you prove that by not earning it. Now, the next question will be, if you're earning less than $13.50 a month, Social Security will try to make a determination as to whether they think you can earn that money. They're trying to figure out if you're lazy. I know you're not, but that's, again, the mindset of Social Security. You will need to prove that you can't work by getting doctor's notes and so forth. Typically, just so you know, you generally don't need to hire an attorney to initially apply for Social Security. You can do it on your own. You make an appointment with Social Security, you bring your medical records, they will contact your doctors, and they will do that research. If you get denied, and it can take sometimes a long time, months or years, to get that qualification. If you are denied, at that point is when you would hire an attorney to then advocate for you for that. If you hire an attorney, typically to get SSDI, they will typically charge a fee equal to a portion, up to a third or a half, of your back Social Security. So the idea is if it takes, let's say your Social Security record says you should get $1,500 as an SSDI payment, and it takes 3 years for them to prove from the date of your application that you are eligible, you would get payment from Social Security of $1,500 times the 36 months you've been waiting since your application. That's $54,000. They would give you that lump sum as back Social Security when you finally win your appeal. Your attorney would then take a portion of that based on the retainer that you sign with them. They may also charge expenses on top. Each attorney works a little bit different. Other questions?
I was just gonna say, I think I'm gonna open the floor to anybody who may have questions that they didn't share in the chat. This is going to be the opportunity to jump in, unmute yourself, raise your hand as an option. That might be a little bit easier on how to gauge that. So if anybody would like to raise their hand, we can get you unmuted.
I don't see any questions. If there's no more questions, we can kind of today, we'll be able to ask questions. Just so you know, as part of this, everyone who participates is eligible to have a 15-minute or so call with me to ask their questions on a complimentary basis. I know often folks will not want to ask questions in a group, and that's okay. We wanted to make sure that everyone was able to ask whatever questions they have.
And I just want to say thank you again, Michael, for joining us, for your insight, your expertise. Also, thank you for all of our participants here joining us in, engaging in this discussion. I know that this probably has left a lot of information for you guys to sit on. We're very excited to get your feedback as to how you enjoyed it, things that you want to learn more of. Don't forget that we do have another session as part of the series next week. And I just also want to thank again for the Global Genes, for the Financial Advocacy and Rare Impact Grant that's been able to make this possible for us. And we hope to have more and more opportunities with our community to have these conversations and this engagement with everybody, and other experts like Michael to be able to help educating us, as well as giving us resources and tools. I know that I've learned a lot myself just through this process. I know that our Patient Advocacy Council has really enjoyed being able to come together as well to help kind of launch this with the FD-MAS Alliance. Again, this is the first part of the two-part series, so please, please, please join us next week on Thursday at the same time, and we'll be holding a follow-up discussion as well as, again, more information that Michael's going to dive into for us, where we can get a little bit more details for maybe some of the topics that weren't able to be covered today. And again, don't forget to do that survey. The link has already been shared in the chat. Again, that really helps us getting more information, really gear it towards the community. And it really helps us shape for the second conversation that we want to have next week. If you have any questions, you can still reach out to us via the info@fibrousdysplasia.org. That can also be listed, I believe, in the chat, Tova, if you don't mind. And again, thank you. It's recorded. We will be sharing this out. So keep an eye out for both that as well as the post survey. Thank you again, Michael, and everybody joining us.
Thank you. Have a great night.